Welcome to the Learning Pines YouTube. We hope this video helps.
You start by assessing circulation and urgency. If the skin is pale, cool, or numb, seek help. Once done, remove any loose links or open the clasp to reduce bulk. Make sure to sit, elevate your hand above heart level for a few minutes to reduce swelling. Apply cold compress for 5–10 minutes, then use a small amount of soap or oil around the band to lubricate the contact area. Keep movements slow and deliberate so you do not worsen swelling. You now compress and create a slimmer profile for the hand. First, wrap an elastic bandage or cloth from fingers toward wrist to push fluid back into the arm. Maintain compression with light pressure. Once compressed, slip dental floss or thin thread underneath the watch and wind it tightly toward the fingers so the band rides closer to skin. Then, unwind the floss in the opposite direction while you gently rotate and slide the watch toward the wrist. Make sure to pause if pain increases so tissue recovers. You finish by carefully removing any wrapping and inspecting the skin. Once the watch is off, wash the area with mild soap and water, check for abrasions, and apply antiseptic if needed. Make sure to rest and elevate the hand for 15–30 minutes to let swelling subside. If you still notice persistent pain, increasing numbness, discoloration, or if the watch will not move despite the floss and lubrication, go to urgent care or the emergency room. Do not try forceful cutting without professional help.
Thanks for watching. Consider subscribing if we helped you.